Dr. Tyler Ing, welcome to the Pain and Performance Podcast, my man.
I appreciate it, Derek. Thank you so much for having me.
Yeah, I am quite excited to get this going and make sure that we're able to do it. Me and you had been kind of talking over social. I came across a bunch of your information, and I was like I'm sitting here taking notes on some of it. So I was like, all right, like we need to chat more. What started you down this road before we kind of dive into the nitty gritty? Because like this isn't the typical route when you get into healthcare of like I want to help people with running and performance.
Great question, man. How far back do we want to go? I guess to start, I grew up as a soccer player. I wasn't necessarily a runner. Soccer was my main sport, and that was like my life for up till I was 22. So I played all the way through high school and then college. Played at the D3 level at Occidental, and that was a really fun time. But at the end of that, I was pretty burnt out. And through my career, I had like my own injuries, like most athletes do, and that's what kind of got me into physical therapy. So that part is not the interesting part because I think every PT has like probably a very similar story to that. But in PT school, I was really trying to figure out like what to do with my life athletically because a lot of athletes after college they go through this kind of crisis of like, okay, who am I? What do I do now that my sport is over? Like, I have to figure out who I am again. And during PT school, I got coerced to do a half marathon by some friends. And my first answer was absolutely not. I don't want to. This sounds terrible. I did not like running in college because in soccer because that's a punishment, not a
Right.
not a thing you enjoy. Uh, but they convinced me. They said there was a beer tent at the end. I was like, okay, well, it can't be that bad. Um, I ended up running this half, and I can't believe how much fun I had. I was like, wow, this is crazy. And I ran like I thought pretty fast, and I was like, I actually enjoyed that, like 13.1 miles, and just the crowd, the energy, the community too was like crazy. Just people are just so supportive, and then and people are trying to give you like donuts in the crowd, and like some people are even trying to give you alcohol. Anyways, it's just a crazy atmosphere, and I was immediately captured by it. So from there, I started doing more races, trained for my first marathon, and that's actually where I stumbled into my first real running injury. I actually got a serious bout of IT band syndrome right as I was kind of peaking my training mileage. And this is also a pretty common story for many
Yeah.
runners, especially newer runners. And I was still in PT school, and I was at this point where I had to decide, okay, do I keep training or do I have to maybe sit this marathon out? Because I couldn't run more than 3 miles without this like stabbing knee pain. And I was like, I never had this before. And I was like, what do I do? Thankfully, we just happened to be in the point of PT school. We're actually going over running analysis. So I was very lucky about that. And a few of my friends and I, we just decided, okay, let's see if we can put a plan together. We've never done this before, but hey, we're learning it. Let's give it a shot.
Yeah.
So we actually analyzed my gait. We came up with a return to run program. I worked on a few strength things, and I actually was able to get an 18-mile run in my training, which was just enough to say, okay, let's go for the marathon. And a month later, pulled it off, ran the LA marathon, first marathon, and my knee survived. It felt actually much better than I thought. And that process, to me, I was like, whoa, that's so cool. Like
Yeah.
we actually had a plan, executed it, and went from I don't think I can run to I just ran 26.
That's amazing. Where was the first half?
First half was Long Beach, California.
Nice. It's quite interesting because I had a very similar thing, although my result was a little bit different. I had a buddy of mine in PT school who asked me to run a half with him in Atlanta, and we lived in New Orleans at the time, which is as flat as you can possibly get. And so we trained, and we go to Atlanta, and Atlanta turns out to have a lot more hills than I realized. And it was one of the worst, most difficult runs I've ever had. Like we got to like mile 6 and I was like, there's this like one very long gradual hill. And I was like, there's no way. Like it's just not possible for me to make it up that thing. And after that, like, look, thank goodness you come back down because I think if, I had another hill or two in there, I would have just like tapped out. But I finished that, and I initially had a marathon on my bucket list, and I was like, nah, that's good. I'll take that off. But now that whatever it is, 15 years has passed or so, you're like, all right, now I think it's time to start looking back at it, and dust off that marathon badge at some point. What do you think when you had the IT band syndrome? What was leading to that? Like knowing what you know and what y'all dug into, what was going on there?
Great question. Yeah, so when we started watching myself run, first I didn't really have any coaching as far as like distance running. That's not really something that's taught in like team sports. They don't teach you how to run necessarily. Um, so we took some basic slow motion videos. I was on a treadmill. I took one from the side, the rear view, sagittal, posterior view, and probably there's two big things that I noticed, and this is something that I see in a lot of runners. Is the first thing is I was overstriding. And for those who don't know that, that means I was landing very far in front of my body, and this is a very common uh, challenge for a lot of runners, and can result a lot of uh, higher impact forces on the passive structures of the leg, including the IT band, which is a passive structure. So that was one problem. The other problem was I was actually crossing over my legs a lot when I was running in the frontal plate. So my right leg and my left leg would kind of like stack over each other as if I was running like on a tightrope.
Yeah.
And that was creating a lot more kind of force going up the lateral column of my leg, which includes the IT band. So those were like the two big things. There were some other things too, but when I modified those, what I did is I modified my cadence, increased my cadence a little bit to shorten my step. That took care of the overstriding part, and then I think I consulted one of my mentors about the crossover thing because I wasn't sure about that, and they gave me this awesome cue of on the treadmill or even just out on the road, just finding a line on the ground, like a pencil thin line or a crack, and just keep your feet outside of that line. Just don't let your feet cross over it. And it felt really weird. It felt like I was waddling or something.
Right.
Like I thought my legs were so wide apart. But then I'd refilm it and like, oh, that actually doesn't look that bad. So I practiced that, and those two things, along with a run walk protocol that got me going, made a massive difference. So those were probably the low hanging fruit that we tackled.
Let's dig in a little bit into the overstriding thing because I think this will lead us into some running form stuff that a lot of people will really benefit from that are listening to this. If we're looking at overstriding, kind of explain what you see with that whenever, if somebody is doing it, what's kind of the telltale signs of it. And you talked about how that creates this abnormal tissue loading, but let's kind of tweeze that out a little bit more, like what's actually happening in the mechanics of the musculoskeletal structure when somebody is overstriding.
For sure. So overstriding, and I'll try to keep this as kind of not to get too technical, but basically it's when the runner lands farther in front of their center of mass. And their center of mass typically is around where their pelvis is. So if you're watching a video of someone running from the side and you see that their foot hits the ground in front of wherever their pelvis is, that's by definition overstriding. But there can be different degrees of overstriding. Someone can be overstriding way more than another person. And I think that's an important nuance because sometimes, a tiny bit of overstriding is not the end of the world. And it really is going to depend on the runner and their context and their situation. But in general, people who overstride people who have injuries tend to have this overstriding issue, and that's why we try to kind of modify it. Now, why it's a problem is because as you're landing farther in front of your body, you end up creating a little bit of a braking force, uh, which is basically a force that's going backwards from where you're running. And that backwards force makes it a lot harder to absorb the force when you hit the ground upon impact. So your leg has to handle a lot more load, and it's in a position where your active structures in your leg, like your muscles and tendons, do not are in a position where they can't absorb that load as efficiently. Therefore, your passive structures, like your bones, your menisci, are going to take up a lot more of that load, and that's where people start to develop things like shin splints, patellofemoral pain, other kinds of joint pain, etc. So that's kind of like the overarching view of why overstriding can be an issue and why we try to change it.
Like for you, I know as I kind of got to where I was working with more runners, can you just like hear somebody running and tell if they're overstriding at this point?
Yeah, I like to think I can. I like to think I can. It's funny though. I did find that on treadmills, sometimes the forefoot strikers, and we'll go into this, but they actually can sometimes be a little bit louder than the overstriders. But there's like a different, I feel like there's a different sound to it. There's like a, yeah, I can't really explain it honestly, but there's definitely a different sound of someone who overstrides versus someone who lands a little closer to their center of mass.
So when you're striding in a perfect position, where would that initial contact be?
If we're thinking of a purely a biomechanical perspective and that to define our perfect landing point, then ideally it is below your center of mass, which is typically under your hips and your pelvis. So that's technically where you would want to land to have zero braking force and to allow the active structures in your leg to do a lot of that shock absorption. That's going to decrease what's called this peak impact force when you hit the ground. And in theory, that should decrease the risk of overstressing some of the passive structures in your leg and reducing your injury risk.
Gotcha. So if somebody is overstriding and they're constantly doing that, and I love the way you describe it, like when you're hitting the brakes, like if you're trying to run and you jam that leg forward and stop yourself, like it's like you're doing that every single step almost. So if somebody's doing that, you mentioned cadence as a correction. Let's talk about that. I know cadence has kind of gotten to it kind of comes in and out of favor, seems to be a buzzword at different times. How does changing cadence help correct that? Are there some other corrections to overstriding? I'd love like if you have any like little kind of techniques people can start using. But what cadence should they be striving to do, and how does that change that overstriding position?
Yeah, I do get cadence questions a lot from runners, and I think a lot of runners when they go online, they will find like, well, what is the best cadence? And a lot of times the number that comes up is 180 steps per minute, and that number is taken more from like observational studies of elite level runners who, and we're talking like elite, and they're running at very fast speeds, and they're roughly running at 180. Now, that does not mean 180 is the best cadence for everybody across levels and different speeds. So that's the first thing that I think people should understand when they're researching this. And we don't really know what the best cadence is for people in general. And it likely is probably something that's more personalized because cadence is going to vary depending on your running speed, your leg length, and maybe just your personal preference. So what I would recommend for people with cadence is we have a good idea of how to change cadence for people who may be injured. And particularly certain injuries like at the foot, ankle, knee, and hip. And what research has found as of late is that if we change the cadence by a little bit, and I mean like by 5 to 10%, because any more than that is going to be really jarring and not economical, that 5 to 10% increase has been shown to help reduce some of these aches and pains. So if you have been struggling with, a lot of knee pain, for instance, maybe you do notice you're overstriding if you watch a video, then that's a person who may benefit from a 5 to 10% increase in their cadence.
Now, if somebody comes in and they're like, "Look, I'm dealing with shin splints, I'm dealing with some knee pain," and they're overstriding, would your initial thought be that they have a cadence that's lower than what their kind of anatomical set point is, or their most efficient cadence would be?
Perhaps, it's definitely something I would look at and consider because
Yeah,
I think cadence, when I instruct my runners to use a metronome
yeah,
to modify their cadence, I think that's pretty much the standard at this point. But I do find that a lot of runners, if we just add that first cue, just the metronome, set it to the right cadence, and let's just see how it feels. I a lot of runners seem to have quite a bit of benefit. It might not take care of the problem entirely, but it's a nice change that can see some quick benefit and get a lot of buy-in from my
yeah.
runners too, because I know there's a whole other set of problems we probably have to deal with as well because, well, pain and injury, especially for runners, it's usually not one factor. It's usually a combination of things.
So, but you're not necessarily gonna go all the way to 180. If somebody comes in and they're at 160, you're like, "Hey, look, let's go to 170 and see how it feels."
Yeah, absolutely not. That would be it would be quite the jarring experience, and it could backfire too because that's increasing your cadence too much is going to cost you more energy, and that's going to really slow you down, and your body might not be ready to handle that cadence. So whatever injuries you do have may just get exacerbated. That's why I always start on the low end. I always start at 5%. I never go to 10% increase on the first effort
Yeah.
because it's a big change, even though it doesn't sound like it. So I start at 5, and I'll adjust it more or less based off how the runner performs and how they feel with it. If they really don't like it, maybe I'll go down to 3 or 4%. Maybe they're really sensitive to it,
Yeah.
or if they're handling it pretty well, maybe I'll bump it up. So always dependent on the context of the runner. I think that's key.
What is there anything else that you give people to like start to get that stride length into kind of a healthy or less painful zone? Is there some, you know, mental pictures? Is there any other exercises that they do?
I do give a few cues that some are not super groundbreaking, and some I've borrowed from some running coaches. So
Yeah.
I think I start with some drills off, and I try to do this over ground off a treadmill sometimes, and then sometimes I'll put them on a treadmill. It depends on how comfortable they are. The treadmill is nice because with cadence changes, a lot of people end up going faster to achieve the higher cadence, so they end up not actually shortening their stride if that's the goal. But with the treadmill, the speed is constant, so they can't run faster.
Nice.
That's one of the benefits of the treadmill is like you force them to stay at that constant speed, so they have to shorten their step to meet that higher cadence. So so that's one way. However, they also have to learn how to slow their speed down when they're doing overground running. So we do have to take them off the treadmill
Yeah.
eventually. Um, One of the techniques I kind of borrowed from like chai running, pose running, is this kind of forward falling technique where it's almost like a forward trust fall. And upon the forward trust fall, you actually catch yourself with your leg. And if you're catching yourself at the last moment, you should land exactly underneath your hips. So it's a forward trust fall, you land underneath your hips, and if you keep falling forward, then you will continue to catch yourself under your hips and you kind of fall into this kind of running pattern where you're landing underneath your hips constantly.
So is this something that like you literally have them stand like legs staggered, start leaning forward, like get right until you're about to fall, and then like bring that back leg under you to kind of catch yourself and just like
Yes.
see what that feels like, where are you landing, all that stuff.
Yeah, and I'll start with one step at a time because I just want to see like, well, where do they naturally go? Because sometimes people land in a big lunge. It's like, okay, let's try to catch yourself a little sooner, and let's bring it back. So we do one step at a time. It's like, okay, now let's add that second step, then the third. Okay, now let's see if you can keep it going across the room. or across, across the block, wherever we need to go. It takes some practice,
Yeah.
but and some people really do well with that technique, and then some people don't. So, it's I that's why it's good to try different things because I never have one thing that's like works universally. Some people it clicks magically, and then others it's like I don't know what's happening. So you got to keep playing around with it.
Yeah, one of the ones for me when I was kind of starting to geek out on running form was like the pawing at the ground. Like don't you're not necessarily like pushing or anything. You should just catch the ground under your body and you're just kind of pawing and trying to be super light. And just that mental model whenever I would run would bring my stride into like a really nice zone where it just felt it felt much better to me, and it was just this like mental kind of picture, like paw, like just be light and let it kind of catch the ground as you're moving. You weren't like using the ground to propel yourself forward, and it was this nice shift for me, that kind of unlocked it. So I'm with you. It's like, but then I tell some people that and they're like, what, I can't even do that now. I'm trying to reach with my foot, and they're like, it doesn't work. So having that different kind of tools in the tool bag idea.
That reminds me of one more cue I think that has helped some people, and I think it's relatable. Is like when you get out of a pool and the ground outside the pool is like really hot, you have to like run to your towel. So that's a cue I've given to a few people. It's like, okay, imagine the floor is like that hot, then you have to like get to your towel. Some people they end up doing that quicker stride pattern to get there. So that's for those listening, maybe that one is super relatable, and maybe that will be the thing that will click it for you. But yeah, it's fun to get creative with these cues.
We're going to kind of keep going deeper on farm, but I want to kind of throw in a few little kind of questions for you that I've pulled from some of your social media and the information that you put out there, which is fantastic. Y'all go follow
Thank you.
Dr. Ing on there. You got some great stuff that really helps. And I ran yesterday, and obviously I'm preparing for this, so I had a few things while I'm running, like rattling around in my head. Although my dog was being a brat because it's rained here for like the last 2.5 days. So he had so much energy that he's just like, all right, let's go. Like, you got to keep up with me. I was like, look, calm down. Tell us about the talk test before we go back to farm. What's the talk test?
Talk test. I really like the talk test because it's very practical. And the what I've I think what's what I want to establish first is that a big challenge for a lot of runners, and again, especially newer runners, but even some experienced runners, is that a lot of runners do their easy runs too hard, and vice versa, where they do their hard runs too easy. Now, this is a problem because one of the big things for endurance runners is that they have to train all aspects of their kind of all of their energy systems that involve endurance. So you have your aerobic energy systems and your anaerobic energy systems. And the best way to train your aerobic base is with slower running, kind of below your lactate threshold. And usually we do that with lower heart rate zones. Now, there's different technologies you can use to kind of figure out if you're running slow enough. But one of the tried and true tests that I think works pretty well, it's pretty dang close, is the talk test. And the talk test is essentially if while you're running, you want to try to be able to have a full conversation without having to stop to catch your breath. Or, I sometimes tell people, I want you to read off a full paragraph of something, like maybe a long text message, and just read it off out loud and do not stop to catch your breath. If you do have to catch your breath, then you are running too fast. If your goal is to run an easy run. Now, if you're trying to run a hard run, you probably shouldn't be talking at all. That's the kind of opposite end of the thing. But for a lot of people, especially the new runners, they're always running too fast too often. And that leads to a lot of burnout and a lot of injury. But if you throw in the talk test, it's a great way to keep yourself in check. And doing so without needing a fancy watch, heart rate monitor, which those are great tools, but talk test is a simple way to do it.
So before we jump back into kind of the farm stuff, how often should we be running kind of the easy runs versus the hard runs? I mean, I'm sure that depends on goals and stuff like that, but if I'm just running, like let's kind of split it into two. I'm just running for health purposes and I'm preparing for a race.
That's a great question. I think this is something that is, I think, still up for debate in like the coaching world in particular of like, okay, how much easy run should we do? How much hard run? What what has become really popular over the last few years is this what's called the 80-20 rule, where 80% of your runs are easy and 20% of your runs are hard. And this rule came about because what we've noticed in the elite levels, especially like elite marathoners, is that their training distribution of their runs is around 80% relatively easy to them, and then 20% is in the harder um, heart rate zones. So if we're thinking heart rate zones, there's a 3 zone model, zone 1, 2, 3, and then there's a 5 zone model, 1, 2, 3, 4, 5. The lower heart rate zones, if we're thinking of a 5 zone model, like 1 and 2, those are considered your easy runs. And then 3, 4, and 5 are considered the 20% hard runs. And most of that 20% is in 4 and 5 if we're thinking about what these elite level runners are doing. They don't do as many zone 3 runs. Uh, Now that's another debate too of where zone 3 fits in this whole discussion. Um, but getting back to how much easy, how much hard you should do, the elite level runners are doing this big distribution of runs, but they're also running at massive, massive volumes per week
Right.
that the average runner just doesn't do. So we have to understand that they're achieving these ratios because they're doing so much volume. At lower volumes, if you're training for like a full marathon or a half as a recreational runner, you may not need to do 80% easy and 20% hard strictly. It can be 60% easy, 40% hard. And the reason why the ratio is like skewed heavy to like easy is because that base building, that building your aerobic endurance is so important for endurance running. Because we're not sprinting here. We're not running a 5K even if we're thinking like marathon distance or more. So you don't need all that speed to handle these races. Yes, there is a component of speed. Yes, you want to work on your lactate threshold. Those are still important, but at the end of the day, you need long, steady state running because that is if we're being sports specific, that is what you're doing.
Gotcha, gotcha. So the easy runs is easy in terms of the talk test, but maybe not the distance. Just so I'm making sure we're clear on that.
Correct. Yeah. So if somebody's running 30 miles a week, then, you're probably running at least 20 of them at a relatively easy pace. So
Yeah,
you're still running 20 miles, and then that other 10 or so would be your harder miles, and that would be more if you're doing like a 60, you know, 66% split. Uh, but that's the idea is that like if more than half your miles are hard, then you're probably not doing something right as far as training, or it's definitely suboptimal.
do you buy into the like kind of almost like train different aspects of the running skill in terms of thinking of running as a skill in different runs? So like where my mind goes is if I'm doing an easier run and I'm using the talk test for that, and I'm making sure I could kind of be at that conversational level, it's probably a little easier for me to really be focusing on form during that run and be practicing some of the stuff that I find challenging. Like you were talking about the like kind of line exercise of making sure that I'm doing that. If I'm on a hard run, that's probably a difficult time for me personally to focus on some of that stuff. So should we use the easier runs to focus on form or problem areas or technique?
E- I it, it depends. I'd say yes. In the beginning, when you're first learning a new technique, I think it should be focused on the slower, easier runs. Uh, that being said, sometimes adding a little bit of speed ends up bringing out some of these form changes we want to see. That's why a lot of running coaches use strides in their training, which is sort of like a version of a sprint. It's not really a full-on sprint. It's more like an 80% sprint. But the strides are used to really like, okay, dial in that form while you're pushing off with a decent amount of speed and power. And sometimes that extra speed brings out the form we want to see. So it really depends. Sometimes it's better to do it when we slow it down, but adding a little bit of speed can also bring out these form changes more easily. So I think you could play around with playing with both is important.
Gotcha. Speaking of that, so let's dive back into the farm stuff. You know, there's been so much you talked about, like when I think through this and kind of research like all the different farms that have come out, it seems like about maybe every decade one gets like super popular and it's like, this is it, we figured it out, we cracked the code. And then 3-4 years later there's like all kind of injuries that we didn't have the decade before that came out because people tried to like fit themselves into this. Do you have, this is a tough question, but I'm going to ask it anyway.
I love
That's
it.
that's what we're here for. Do
Yep.
you have specific tenets that you're like, these things, no matter what your idea of form is, need to be accomplished for us to have good running technique, performance, and injury prevention? Like, is there like, however we do it, we need to check these boxes?
That is a good question, and definitely not a simple one to answer because I think this is a question that we'll have to keep asking because I think it will always change as we learn more. I'm sure the answer 10 years ago is very different than now. I'll say this. So I think whenever I'm messing around with somebody's running form, I always have to keep in the context of like, why are we doing this? Are we trying to improve performance? Are we trying to help with an injury? Are they achieving their goals with their current running form or are they not? If the runner is, doing great, they're happy with their performance and they're injury free, I see no reason why to mess with their form. Uh, Even from a prevention standpoint for injuries, because we don't have great evidence kind of predicting injuries with running form alone. There's some we got hints of it. There may be something there with running form, but we just don't know for sure. Like, yes, if you overstride, you're for sure going to get an injury. We don't have that data yet, and maybe we will.
Yeah.
But if I see a runner who's accomplishing everything they want, I am not going to touch their running form because maybe their body has adapted it in a way where they can handle that level of overstriding or whatever funky running form they got. Even if it makes my eyes scream and I'm looking at it and I'm like, "Oh my God, this looks ugly," but they pull it off. And so that's the first thing. If they're all good, I'm not going to touch it. That being said, if they are dealing with, let's say, if they're dealing with an injury, then we have way better kind of research and support to back our changing of certain things in their technique. So I think overstriding is definitely one of those where we can confidently say if you're having something like patellofemoral pain, yeah, shortening that stride is probably going to help. Same with shin splints. We could definitely see an improvement if we shorten that stride, increase that cadence a little bit. Um, Trunk position is something I look at commonly. That I think helps a lot of my runners, especially people who are very vertical in their trunk while running, or they're leaning backwards a little bit, tends to be showing that they may be more quadriceps dominant in their running, and that they may not be engaging their posterior chain as much, particularly their glutes. So that's something I will maybe help them use more in their running, a little bit more of a forward lean, which a lot of running coaches are big on that. Uh, and then I also look for things like pelvic drop, dynamic knee valgus, um, pronation of the foot. That's a little bit of a hot subject that I've talked about in my content too. That I think pronation is something that definitely gets vilified on the internet. And again, depending on the context, most people pronation's fine. Some people may benefit from a little less of it or more control of it. Um, but yeah, it just really depends on, is there a problem to fix? Because if there's not a problem to fix, I'm not going to be the one to try to fix something that isn't there and maybe cause a new problem, which is definitely not what I want.
So somebody comes in, you're an overpronator. Hey, I feel great, doc. Like I would like to bring my, my splits down by 10%. Um, in that situation, are you just like, all right, we're just going to leave that alone?
For the overpronation,
Yeah.
yes, because there's not I'm not aware of any study that says if we reduce pronation, you're going to increase your running performance by 5 or 10%. If that study comes up, I will definitely be on top of it and I will use it. But no, there isn't really anything out there to that effect. Uh, Performance studies are still just not where we want to be yet to really make um, those decisions for runners and be like, you have to run this way. Now, I still will make some changes based off, like, I look at the elite level, right? And we see elite level runners, for the most part, they do run very similarly. So I think there's lessons we can learn from the elite level, and I think it would be foolish to not consider that. Uh, but doesn't mean that that's the only way to run. And I think that's something that I'm very big on, is that there's not one way to run successfully, like a lot of things in life. So that's that's probably the biggest message I can send to runners, is if you run a little different and you're fine with it and you're performing well and you're happy with it, then that's okay.
Yeah.
Keep at it, because maybe you're a little bit you're adapting better to this particular running form.
I think the issue that I, some of the listeners would have with that is they're like, I don't know if I'm doing okay with this. Like, I wanted to start running, and so I did. I went out one day and started doing it, and I'm putting some miles on in a week. But I don't know anything about form. I'm not thinking about anything while I run. I'm waking up and I'm going out and I'm doing it. I've certainly gotten a bit faster because, I'm getting in better shape. I've been doing this for a couple of years, but I have no idea if I am, in a good position or not a good position, or if I'm zapping my energy or any of that stuff. So if you're talking to that person and they're like, I just want some frameworks to think about my running form, posture, position, movement. How do you start with that part? If it's almost like, they're like, look, I just want something that gives me some guidance on it. Does that make sense?
Yeah, that makes sense, and I definitely can understand that frustration, especially if you're just trying to get in the run. You're like, where do I start? And even though we don't have like the best maybe research to make these like perfect predictions for people, I think it's very easy to maybe tell people, it's like, okay, I think one, make sure you just start by running slower using that talk test we talked about. Because if you're running with a running form that's definitely not ideal for you, it's definitely going to get exacerbated if you start running faster and increasing your mileage at the same time. It's just going to be a recipe for not good things. So start by going slow, regardless of your form. And then if you want to get into form, you know, think about, there's a few things you can focus on. One, that forward trunk lean. That forward trunk lean or leaning, I like to say, like, pretend you're running into a big wind tunnel or into a tornado, or even, this is even easier, find a small hill that you can run up, because a little bit of an incline is going to force you to lean forward. It's going to force you to land under your hips and run with this kind of running technique we've been talking about that is probably more ideal. And that's going to help you kind of start making these changes without having to think too hard. That's the big thing. I don't want people thinking like, oh, I got to move my body in like 10 different places, because if we get to that point, then it's going to be a mess and you're going to get frustrated and not see the results you want.
Gotcha. Yeah, those are helpful. It's funny because whenever I was training a lot, there's a little, very like slow, and it's probably a tiny little hill. Look, I'm in Louisiana. Everything's a tiny hill, um, but that would be about halfway through my runs, and for me to get up that, I just had this nice little lean, and it was kind of the tough part of the run. You're kind of hitting this, but it always felt good to do it. Like I felt like, man, I'm something is happening whenever I get on that makes me feel good, even though I'm running uphill. And so, like, even as you say that, I'm like, I wonder if I didn't have enough forward lean in the rest of my run, and whenever I would get into that posture, it just kind of gave me that little kind of 2% change that put me in a better position. And so my cadence, my form felt a little bit better.
Yeah, no, definitely. I think those subtle changes make a massive, massive difference. And I think another way you could do is if you hop on a treadmill, um, if you're a person who likes the treadmill, just up the incline by just a couple grades, and that slight incline is going to help with that form adjustment, just like we talked about. And yeah, you don't even have to think about it; just happen automatically.
If somebody's kind of on the other end and they're trying to improve their performance, they're trying to like increase speed, I'm trying to, set some PRs. What are the more advanced stuff that you're looking at with them? So, I mean, like, some of that's probably the basic stuff, but somebody's like, look, I'm trying to hit my goals. I've got some records to set. What are the things that they can work through that are more on that kind of advanced level?
From the form perspective,
Let's do both. I mean, I'd say form or performance or training.
I will say probably I think the biggest needle mover is going to be your training program more than the form because I mean, there's a lot more evidence behind, training styles as far as affecting your performance. From the form side, I do think it is just focusing on the basics. I think perhaps increasing the turnover of your steps a little bit more than, baseline. Uh, there's some I think the running coaches, I always go back to the running coaches when it comes to performance because even though we might not have the science to back a lot of these performance changes, the coaches kind of know because they've been in the game for so long and they've been playing around with this stuff. The coaches know before the science catches up.
Yeah.
So what I do is I listen to the coaches, the best coaches. I'm like, okay, what are you guys doing? And I'll just copy them because they've been trial and erroring it for many years. And
Yeah, sometimes it's good to not have a dog in the fight, right? Their only answer is like, did it help? Like, I don't care why it helped, but they're performing better, so I'm happy.
exactly. So, I mean, a lot of them have a great pickup of their leg, kind of their trailing leg. So creating this like what you call almost like a circle of your foot while you're running. So it's almost like you got wheels. You're almost like drawing a wheel or a circle with your foot with each stride. And the bigger that circle is, the kind of more efficient your stride is going to be. So that's something that coaches often preach to their higher level runners, especially when we're trying to build speed. And if we're trying to lengthen their stride, a lot of times we are trying to, that circle is going to help, especially if we're thinking about pushing off to create a longer stride rather than overstriding. So that's a big difference. So we want to lengthen the stride to increase your speed because longer stride with higher cadence, that's how we go faster. It's the simple math. But we don't want that longer stride to be from overstriding because that's going to create some braking force. So we want the trailing leg to be extending back, pushing off more. That's why you see some little snapshot of a runner and you see that beautiful trailing leg that's like nice and straight point away. It looks super cool and athletic. That's what we want to see. And that's something I think at the higher level that's going to really up your performance from a form perspective.
Gotcha. What about the
From
training? Yeah, let's
Yeah,
get into
from the
that.
training perspective. Now this will depend on the event you're doing. If you're running a 5K, if you're running 800 meters or a marathon, then your training program is going to vary quite wildly. But I think one of the big things for across a lot of, I would say most running domains is that volume's pretty big. Volumes, the more volume you have, tends to be the better your performance is. And it kind of frustrates me because I'm like, that's so simple. Like that's not complicated. I was like, there's really not much more to it. I mean, yes, there is more to it, but at the end of the day, we see people with if they're able to put out higher volume, they perform much better, whether it's a 5K or a marathon. Um, and this is actually pretty relevant. I mean, we just saw Kelvin Kiptum
I was gonna ask you about that.
smash, yeah,
Yeah.
smash the world record, which is insane. And I was reading up on him because I was just like, well, I gotta learn more about this guy because I had just heard about him the first time when he won London back in April, and then he had run at the time the second fastest marathon. I was like, holy crap, this guy is he's going to break the world record, and he did it. And I was looking at some articles about his training, and he's running insane volume right now. Like he's running, to put in perspective, I think he's running around 300 kilometers per hour, or sorry, not per hour, per week. And Kipchoge, Eliud Kipchoge, the previous world record holder, he runs more around 180 kilometers per
So
week, which
almost
is
double.
almost double. And Kipchoge, I mean, he's still running like a massive amount of volume. This guy's almost doubling it. Now, is that why this guy is the best? I don't know if this is the one thing that's determining it, but it's quite notable that he is running this much more. And now it's funny as well, though. His coach has said to reporters that he is unsure if Kiptum can even sustain this amount of volume for that many years, that he might need to actually pump the brakes because he's kind of going ham right now. I mean, he's really definitely hitting his stride. So you do have to be cautious about your volume too. Running more doesn't always guarantee success. And I think you have to really earn the right to run more as well, because if you're a newer runner, you can't just suddenly start running 40, 50 mile per weeks if you've been only running 5 or 10 a week. You have to build up to that very slowly. And when I say slow, I don't mean like a few weeks or even a few months. I'm talking years,
Yeah.
because if you want to be a runner and you want to be in this game for a long time, you have to think long term. You have to think, where do I want to run, or where do I want to be as a runner in 10 years, not just next year. And if you think with that mindset of like, I'm thinking the next decade, then you're going to approach your training over the next few months much, much differently. And you'll probably have a lot more patience, and you won't be as frustrated if you're not reaching these insane levels.
Yeah, one of the things that I've started, I make a lot of my decisions around training is kind of this, like I stole from Peter Attia, the idea of like the centenarian, Olympics, so to speak. And like it's like, can I accomplish like this year's goals along the way to me hitting this long-term goal of like the centenarian Olympics, of like being 100 and being able to be athletic, is the whole idea around that. And that makes me make some different decisions in terms of, especially when it comes to running, because it's like, you know, if I have to go so far out of the path to hit this year's goals that it's going to take me, out of the running for being able to accomplish those long-term goals, then I need to adjust my immediate goals. Hopefully that makes sense to everybody, but it's like, if I have to, put myself at risk for an injury or something like that, so much so that it negatively impacts my ability to kind of accomplish my long-term goals, then my short-term goals aren't quite as, well set, so to speak. So it's helped me to kind of view this idea of kind of pushing and training in a better, probably more helpful light. Whereas when I was younger, it was the opposite. You're like, I don't care what it does to me next year. I need to accomplish, this short-term goal at the expense of next year. Whereas now it's like, no. This should just be a way that it helps me accomplish that long-term goal.
Exactly. It's a stepping stone. And
Yeah.
yeah, I think that is the best way for runners at any level to kind of approach their training. It's like, think the long term, think of your running journey as a marathon in itself, right? I think the marathon is the perfect analogy for people running and running for life. The first half of the marathon, you're not racing. You're just running to the starting line at 13.1. So if the first half of the marathon is like the first few years of your running journey, why are you trying to race to the starting line? You know you're going to hit the wall, you're going to bonk, and no one wants that to happen. So yeah,
I
I'd
do
say
something.
just
Sorry to cut you off. I do something
yeah.
called backcasting. Have you heard of that?
No, I have not.
So backcasting, there's forecasting where you like forecast, like that's kind of visualization, forecasting what might happen, all that kind of stuff. But I heard of this a few years back, and I think it was actually the poker player Annie Duke who first kind of described it. But what she would do is she would go forward like in the future. So she's like, whatever my goal was, whatever that time frame is. So, if it's a year, I'm a year ahead of time. And then I backcast. If I accomplished my goal, I backcast what habits or what changes or what things did I do that allowed me to accomplish this goal. So like how was my day structured? How was my week structured? How many miles did I run? How much did I do? What was my training program? How much cross training? And she was like, you know the answer to these things intuitively. You just have to get your brain in that space to do it. She was like, but then the real power of this is to stay in that future mind and backcast the negative, which is I did not accomplish my goal. What things stopped me from accomplishing my goal? And a lot of that is the stuff that we start missing. So in this aspect, you're like, okay, well, I got injured. What can I do now to prevent that injury from derailing me? I got sick and I couldn't train. Okay, well, maybe I actually need to pay attention to some rest and recovery and immune health. I got too busy. Let me look at my schedule. Like it creates I think the positive creates like your perfect scenario, and the negative kind of creates the real world scenario of like, there's going to be chance, there's going to be problems. How do we mitigate those as much as possible? I love that exercise for people who are saying, I want to run a marathon next year. Okay, let's sit down for a second and run through that exercise and see what answers come up to you intuitively.
I I love that. I am going to steal that and use that for myself. And I think that yeah, that's a great one to do with patients and clients because I love having my runners really reflect on yeah, past successes and failures because that is, we have to really capitalize on those events to kind of have better outcomes in the future. So, love that. I'm definitely going to steal it.
Yeah, I have a patient right now who we did it yesterday because he's training for a marathon and showed up, I think last week where and was having a lot of pain, like calf pain and stuff, and was like, look, we need to look at this because there's no way that if you look back and you just keep pushing through this, that was a successful strategy for you to accomplish this goal of like, doing well and running a marathon. Can you finish it? Maybe, but that's not going to be a good strategy. So, I think putting it in that light, he knew, but that brings up the question that I would like to dive into, which is, when we're talking about, kind of having some injury prevention strategies, because that's the big one when it comes to physical stuff is like, if you get injured while you're training, it derails everything. You can't push through it because you're just going to make things worse. So when we're looking at some of the injury prevention strategies when it comes to running, what's your toolkit for that? What's your kind of big thing that people can really pull from?
Good question. And yeah, this is definitely another one of those questions where the answer is not maybe super simple, but I think if I were to really give the essentials, I would say, well, one, as a runner, you want to make sure you have a sensible training program because the majority of running injuries are due to training program error, where they are running either too much too soon, too fast too often, and that is like 90% plus of running injuries. They come to me, it's like, yep, I was running more that week, and then bam, felt the calf pop or something like that. If we can get people to run with more sensible training programs, and this part is tough because training programs are often they're one of one because there's a million programs online and they will work for a good amount of people, but for a lot of people they will not work because they're not keeping in mind your personal fitness level, your goals, your injury history, the rest of your health history. So that part is tricky. So if you really want to prevent injuries entering the running scene, you probably want to work with a running coach or a rehab specialist who works with runners who can help you design a one-on-one, a personalized program. That in itself would help tremendously. Now, in addition to that, I think the big thing that runners, a lot of them hate, but they need it so much is strength training. And they need to strength train. It is not a negotiable, and it should always be part of a runner's training program. It always frustrates me when I see a running program that tells them exactly how to run, the perfect dosages, the distance, the thresholds, the heart rate, and then it'll have a day that says, "Oh yeah, strength train or cross train," but no details at all. It's like, what does that mean? It's just so vague, and then they end up going online to be like, "Well, what's strength training for runners?" And they'll find 10 million things, and a lot of them uh, probably aren't of the best quality, or they're not meant for them in their context. So I really, really try to help as many runners as I can learn about strength training, what strength training means for runners, how you can implement it in your training without getting in the way of your miles. Because I know a lot of runners are like, well, I just want to run more. And I'm like, perfectly fair. I do want you to run more too. And if you strength train, you're going to be running for a long, long time. You won't be stopping anytime soon. So those are probably the two big things. Making sure your training program is adjusted for your needs and your level, and making sure strength training is somewhere in the training program and that it's the right dosage. It's not just 30 reps body weight squat. That's not good enough. We need some load, we need to be heavy, and we need some sort of single leg aspect as well.
If you could kind of run down a few like moves for strength training that you prescribe to your runners most often, what's kind of the main ones that you start with in that aspect?
For sure. Yeah, and these I mean I use these almost all the time. Some variant of these. So I mean, one thing is there has to be some form of calf strengthening. Calf muscle is sadly the most underrated muscle in the lower extremity, especially for runners. And it's ironic because it's aside from the heart, it is got to be the most important muscle for runners. We have studies showing how much force in times of runner's body weight that the soleus muscle, which is one of your calf muscles, takes up during running. And it's like it far exceeds that of the quadriceps, the glutes, the hamstrings. The soleus muscle takes up so much load with running. And but yet so many people do not strengthen their soleus or their gastroc or their feet for that matter. So I always include a form of a calf raise of some kind. There's a million ways to do it, but there's got to be some sort of calf raise in your program to make sure that that calf is functioning healthy and getting stronger because I know people want to run more and faster. So we got to up your calf game to do that.
Love it.
So so that's the first one. And then probably the second exercise variant that I always prescribe is some sort of single leg strength activity. So it could be a single leg squat. I love to do single leg sit to stands. This is probably one of my favorite exercises of late because it's so practical and yet it can be so hard for some people and it's very scalable because a lot of runners are very gym adverse. They're not fans of the gym because, I mean, to be honest, the gym can be intimidating. If you're not someone who goes to the gym often, you go in and you see all these, some buff people in there lifting some crazy weight, and you're this, lean runner. You're like, I don't know if this is my space. So one way I help them, like, okay, if you don't want to go to the gym or if you don't have a lot of equipment, sit on a chair. Can you stand up and sit down on one leg? Can you do that 20 to 30 times without stopping? A lot of runners can't even do that,
Yeah.
which is a big red flag for me. I'm just like, okay, if this is a problem, then in my mind, I'm like, I don't even know if you've earned the right to start running yet. And I know that's a harsh thing to say, but I mean this from a place of caring, because
Yeah.
if you don't have the single leg strength to do this kind of test, then I'm very worried and concerned that you may suffer an injury doing a sport that is based on repetitive single leg jumping, essentially,
Yeah.
and doing that thousands of times. So if you don't have the prerequisite strength, then running is going to be a riskier business for you.
Yeah. Yeah. What are some of the ones that people miss? Like, I'm sure that's probably part of the answer, but are there some other ones, that come to mind that most runners, if they are getting in the gym, it's like you're doing great. Hey, you're halfway there, but are you training X?
Besides those two, I think a lot of runners say that they train their glutes a lot, because I think glutes are very. I think we're at a point right now where like a lot of people are aware that, oh yeah, glutes are important. Glutes have gotten a lot of attention, maybe more attention than they need at the moment. But for better or worse, they've gotten a lot of attention. So a lot of runners, they're like, oh yeah, I do work on my glutes. I do some band work, stuff like that. But I see a lot of runners often not do some of that glute specific training in the most optimal way, or they do it with a lot of compensation, which they realize, oh, you're not actually training your glutes that much. You're actually training more of your TFL, and you got a great looking TFL there, but your glute max, your glute med are actually a little underdeveloped, which can be surprising to some people if they've been doing band work for so long.
Yeah.
So
What's
I
your
really,
favorite glute exercise?
oh, okay, this one, oh man, this one might stir the pot. I actually think the clamshell is one of the best glute exercises, even though it is, I know that one's vilified, I think, a lot in the PT community. And I'm a clamshell supporter. And I will
Explain to some of the people who aren't in this what a clamshell is.
okay, clamshell might be the most maybe one of the most popular, and maybe some say like generic exercises in the physical therapy world, where you have a band around your knees, you lay on your side, your knees are bent to 90, and you open up your knees, keeping your feet together like a clamshell. So you're trying to spread the band apart, and it should get your glutes working. My and then I think a lot of people moved away from clamshell because people were doing like 3 sets of 10 all the time, and like they weren't seeing benefits, and it's like, well, we need to step up from clamshell. And I agree, there's a lot of other things we want to do besides the clamshell, but I strongly feel that the clamshell is just done so poorly in clinics as far as like the quality, the technique, that no one's getting the benefit of the clamshell. So they throw it away, and then they go to more advanced exercises that they're not really ready for when they can't even do a clamshell properly. In my mind, if you can't do the clamshell, then how are you going to do banded walks? How are you going to do like complex hydrants on one leg and then catch a ball and like, do all the cool stuff that's like cool
Yeah.
on Instagram, but you can't even do a clamshell. And I see so many people compensate. Like when I see them, like, okay, you can do a clamshell? Show me. They do the clamshell. Their pelvis rolls back like crazy. Their TFL's on fire. They're like, oh yeah, I feel it all in my quads. Okay, then there's a problem there, because we shouldn't be feeling it there at all. So I will take a runner. I will put the band on them. I will humble them. I will make them open the clamshell. And I personally do isometric holds. So I usually start with the isometric hold rather than isotonic reps. And I have them do that because I really want them to feel their glutes and improve their neuromuscular control. And the isometric rep helps with that. And I'll be like, all right, let's do this clamshell. You're going to hold it for at least a minute. And if I see this thing drop, and I'll put like a cue, like maybe my fist or a tissue box to put between their legs. So it's like, okay, don't let it drop. And then I'll also watch for compensations, because if I see them rolling their hips back, I know that's a problem. I'll put a cue behind their back and be like, okay, I'll put this foam roll here behind your pelvis. If you touch the foam roll, you're done. Test is over. And then we have to reset. And their butts light up. They are on fire, and they're like, oh, this is what it's supposed to feel like. So yeah, I think if we do our clamshells to a higher quality, then the clamshell becomes an amazing exercise to get the glutes firing. And then you can progress to these more advanced uh, glute strengthening variants, which I think are also important. But we have to make sure we can do the basics first
And it's
because
awesome to go back to those basics. I have a buddy of mine who's a power lifter, and I brought him in, and we did probably like a 30-minute, we did clamshells, we did some glute med work. He called me the next day. He was like, look, I mean, this is somebody who regularly lifts 600 pounds quite easily. And we go back to the basics. He was like, I haven't been this sore in years. And it's like, are you going back and telling those little stabilizer muscles, in some of these and just doing the basic moves to work again? So I think even if you have advanced to doing some of the more advanced kind of glute work, to have, a day every other week where you go back to the basics, it can be incredibly powerful.
absolutely. The basics will matter no matter what level you're at. This applies to all sorts of worldly skills, but definitely for glute training and especially for runners.
So if we're staying on the injury prevention side of things, those are brilliant. I think setting up the training program and making sure you work with somebody to do that, because yours is going to probably be different than everybody. Progress that thing correctly and slowly. Having some strength training. We talked a little bit about like the running readiness stuff. Are people ready to do this, and a few tests that they can kind of do on themselves? Give us a couple of those that somebody listening to this can do to start to know where they're at.
Well, I kind of teased this earlier, but one of my favorite tests is the single leg sit to stand test because that's a great simple way to measure single leg strength, and it's a little bit of balance test too.
Yeah.
So I really like that one, and usually I want my runners to be hitting at least 25 of those per leg. There hasn't been a study of this specifically for runners, but there was a study revolving around ACL injuries and this single leg sit to stand test, and they found that people who could do at least 22 or more had a lower risk of an ACL injury if they could
Nice.
accomplish that number. So I've kind of taken that test and just translated it to the running world because knee injuries are super common, and I found that test to be really helpful and eye-opening for so many people because they think they see this test and they're like, it can't be that bad, and then they're like, oh, like that's actually very hard, or some people can't even do it, and they're like, whoa. So that's a great test, and if you feel it's too easy, we'll just grab some weight, grab a kettlebell, put on a backpack, stuff some textbooks, try it again, and then bam, you have an exercise out of it.
Nice.
Yeah. Another test, calf raise test. We talked about the importance of calves, but there is a standardized way to do a single leg heel raise test where we can do, it's basically a rep max test where you're on one leg, going up on your toes, up and down at around a frequency of one rep every 2 seconds. That's how this test is standardized. You can use like a metronome if you want to set the tempo. And you want to perform, as many reps as you can. And that test is nice because we have data, normalized data for both males and females across different age groups. So from 20s to, I believe, 80s, we have normative values. So I really like that one because you can figure out, like, is this strength normal for my sex and age group? So those are two really big tests that I like to use. And then another test that I use commonly is actually a variant of a side plank. And it's more of like a star side plank where you're in side plank position, your top leg is elevated in the air. So only your bottom leg is supporting you.
Gotcha.
Now, this test, I like to test a lot of frontal plane strength, particularly the glutes and the gluteus medius, which is one of those muscles that we really look at runners because sometimes we see people who have a lot of pelvic drop or trunk lean while running. Could be related to some of their issues if they have like hip pain, knee pain. We may want to see if the glute med is a muscle that needs more strength or control. And that side plank test with the foot elevated is a nice way to test this at home if we time it. and see like, can you even hold this position for 30 seconds? Can you hold it for a minute? And it's a very hard test, but I intentionally give it as a hard test because if you're going to be running at a marathon distance, you better have a strong, above average gluteus medius. So I like that test a lot because that's another one that's like a little bit humbling and very challenging and very scalable because I think no matter what level you're at, that test will be hard to some degree and you can really continue to work at it.
Yeah, yeah, you'll never completely like have that under control and master that. Those are awesome. Y'all run through that. If you're listening to this and you're a skilled runner, you'll surprise yourself by running through some of that stuff. You've got a few more that you have people go through. People can find some of that information. They can get. You said you have a little resource packet for people.
I do. I have something called a running readiness guide, and it actually goes through 5 tests, including the 3 I just mentioned. So it has the instructions, there's videos linked to it, and then it also gives you the scoring rubric of, okay, this would be considered a pass, this would be considered something you need to work on. And ideally, if you can pass all 5 of these tests, then you're probably someone who has decent fitness to be running healthy and potentially have a reduced risk for injury. Now, if you don't pass one or more of these tests, then that's something you may want to work on. And you may want to be cautious about ramping up your running mileage or intensity before you start. Before you want to make sure you pass these tests before you start doing that.
Gotcha.
So, yeah, that's a resource, and happy to share that with anyone who wants to take a look at it.
Yeah, we'll throw a link probably in the email in the show notes. Y'all can find that and download that. I will be doing that as soon as possible. Make sure before I start to ramp things up. I need to go back to the drawing board with a little bit of this stuff. Doc, let's run through a couple myths real quick if we can. I'd like to dive in. We've touched a little bit on some of this stuff. The strength training causes us to run slower, and vice versa. That running causes us to lose muscle mass. Give us the truth on this. I hear that everywhere.
Unequivocally false. And I can say that too because there have been studies looking at this. We have studies showing runners implement a really decently designed strength program where they're lifting pretty heavy. We're talking like 85% of their 1 rep max. So for those who maybe aren't as familiar with strength training, think of like you're doing a set of like 8 reps and you're only 2 away from failure. Like you're like close to failure. Not quite, but you're pretty close. So it's pretty intense. Yeah. We've seen these runners do like an 8 to 12 week program and retest and get stronger. They're truly stronger, but they put on like nearly zero mass. They are pretty much the same weight they were from the start of the program, but they are stronger. And on top of that, they're running faster. We're seeing improvements in their running performance, which is that's the main goal of this is like runners want to run faster. They don't care about being stronger for the most part. They're like, is this going to help me run faster? And the great news is, yes, it does. It does help you run faster without putting on weight, which I think that is a big concern of some runners.
All right, I'll cross that one out. I've gotten this one from so many people. I'm having pain because of my flat feet.
Oh man, yeah, that's a one that is frustrating because I think flat feet they often get blamed for a lot of things. I'll tell you, I'm a flat-footed person, very flat foot. I've had injuries in my feet before, but I gotta tell you, I haven't had an issue with my feet for years, and I don't wear orthotics. I haven't had to wear shoes with high arch support to help me in my running. I run in all sorts of types of shoes, and I've run a lot of different training programs in the past few years, a lot of high mileage, high intensity, and have been perfectly fine for my flat feet. So that's me. I'm an N of 1. But flat feet, we've seen this in research too, is that flat being a flat-footed person by itself is not increase your risk of getting injury as a runner. There are other things that play a much bigger role. And sometimes if we adjust arch support or foot strength, those can help, but it's not a guarantee. There's a whole host of other factors here. So if you have flat feet and you're running fine and you're feeling good, then don't worry about it. If you are having issues, work with someone who can give you an assessment, because the flat-footedness may not be the problem.
I feel like I know the answer to this, but that leads to like the shoe question, and I've purposefully kind of left this off a little bit. I feel like that can be a whole kind of rabbit hole in itself. But how what do you tell people about shoe selection?
Another very common question. And it makes sense. I get it, because there's so many shoes to choose from. And then we have a whole new category of super shoes now that is very popular because we're seeing all these world records get broken with people running the super shoes. Now, the super shoes are not breaking the world records. Let's be very clear. It's not the super shoes. Um, there is research supporting that maybe super shoes can increase running economy by a couple percent, but that is happening in people who run very fast already. We're talking like if you can run a sub 3 marathon already, then you may benefit from a super shoe. But if you're not running sub 3 in the marathon, you don't need to spend all that money for a shoe that's going to last you like 3 races. So that's my little rant on super shoes. I think that's important. Uh, as far as picking the shoe that's the right one for you, it's this sad to say, but the best we can say based off the current literature is that usually the best shoe is the one that feels best to you, that's most comfortable. And I know that seems oversimplified, but that is what we found to be best working. We've tried the model of kind of neutral motion control shoes, and trying to put them based off foot type, and it's just to mixed results. We haven't had clear like, yep, these people definitely need neutral shoes or motion control. Uh, so, I've worn, technically I should be wearing a motion control shoe based off my foot type. I do not like that at all. It doesn't feel good for me. It really bothers my foot. I do much better in a neutral shoe because it just feels better. So the best advice I can give you is just try some shoes on, go on a run. Most running stores have great policies on returning shoes. You can run in them for a month and return them without being charged. So take advantage of those policies. Try the shoes. If you like it, great. If you don't, return them. Try something else. Um, and I'd also be cautious of running shoe stores that do kind of like the foot posture devices, and then try to base your shoes based off that information. That's something I would be cautious of, because I see that becoming more and more popular, and it's a little something I think is a little concerning because it doesn't always work to the benefit of the runner.
Yeah, it's a static thing. It's fancy, but you're just sitting still, standing on these things half the time. If we're talking about like some of the scan devices and stuff like that, you're like, that's great, but I'm quite interesting because I'm very flat-footed as well. As soon as I start running, I tend towards supination. And so if you gave me corrections based on my little foot scans, um, a lot of times you're gonna put me in something that, like you said, does not feel very good. And that frustrates patients sometimes, but I'm like, I think this is fantastic because it tells us that our body knows on some level, like, does this actually feel good to you when you're running? Or is it like, oh, it feels a little, it feels off. I can't put my finger on it, but something's not quite right. It's like, listen to that information.
Absolutely. I look at it from a positive view as well. It's like, wow, this is great. You don't need a fancy shoe assessment to figure out what's the right one for you. You can just pick the coolest shoe on the rack, try it out, and if it works great, then you're in business.
Running's bad for your knees.
No, it's not. I could leave it at that. But but no, it's not bad. We have research evidence to support this. There's a pretty well-known study that looked it was an observational study, I believe, but it was or yeah, they looked at the prevalence of osteoarthritis in the knee and the hip amongst runners. You may have heard of this study. They looked at it from sedentary, recreational, and more elite or more avid runners. And the sedentary group had a higher prevalence of osteoarthritis than the recreational runners did. So that in alone is already kind of saying like, okay, well, how is that possible? How could running be truly bad for your knee if a recreational runner has less arthritis than somebody who just sits all day? So yeah, running is not bad for your knees. In fact, I'd say it's very healthy when you're doing it at the right dosages. So that's the key is in the dosage. That's the key thing. So, but yeah, running great for knees.
Doc, I've got like 4 pages of notes and scribbles and things that I need to do. This has been awesome, man. I've got all kind of good stuff. You got any parting thoughts? Anything we missed that you really want the listeners to take away?
Oh man, I mean, I think we covered a lot, which you asked some great questions, and I really appreciate that. I'd say, if you're out there as a runner or someone who wants to get into running, just I think be patient. That's the big thing. Like this is a sport all about patience, and you're not going to figure it out right away, and you don't have to. That's the great thing. If you want to run for, the rest of your life or a good number of years, take your time, learn from people, run with a run club, find a coach, find a PT who works with runners, get all the information you need, and then just enjoy the ride. I think that's maybe that'll be my parting shot of wisdom.
I love it. Well, I have to ask you the one question we ask all our guests, which is if somebody's listening to this and they could do one thing today to improve their health, what would that one thing be?
Oh man. Go out. I mean, I'd say like if you've been thinking about running and you haven't done it, I say just go out and do it. Go out and try it, and see how, like I think starting is even if you don't feel like you're ready or healthy enough to start, I think you need to just get out there and do it because if you keep thinking about it and you keep pondering it, it's never going to actually happen. You have to take action, go outside, lace up the shoes, give it a go. And then if you just take that first step, you're already doing better than the majority of people out there.
Dr. Tyler Ing, thank you so much for joining the Pain and Performance Podcast, my man.
Dr. Derrick, appreciate having me on. Thank you so much.